Hi everyone, welcome back to ilovepharmacology. In this session, let us learn about the differences between the thyrotoxicosis and the hypothyroidism. So usually in case of thyrotoxicosis, the patient presents with warm and moist skin. The skin temperature will be more. He will be sweating. He will be having heat intolerance because already he has got warm and moist skin. And when you examine, there will be increase in the heart rate, there will be increase in the stroke volume as well as the cardiac output, and also the pulse pressure will be more. There will be difficulty in breathing, there will be increase in the appetite, the patient will be having more food, and they will be nervous, there will be hyperkinesia as well as tremors in the hands, and there will be weakness and increase in the deep tendon reflexes. The tendon reflexes will be hyper exaggerated, and in case of females there can be a menstrual irregularities, and there can be a risk for decrease in the fertility. There can be a weight loss due to the increased metabolism in case of thyrotoxicosis, and also there will be retraction of the upper eyelid with wide stare, which gives us a look of exophthalmos, that is a protracted eye, which is the classical presentation of the Graves disease, which is a thyrotoxicosis condition. In case of hypothyroidism, usually the patient will have a opposite symptoms and signs to that of the thyrotoxicosis. Hypothyroidism patient presents with pale, cool, puffy yellowish skin, face and the hands, and there will be brittle hairs and the nails. There can be a loss of hair as well, and sensation will be cold. There will be decrease in the heart rate, there is a decrease in the stroke volume, cardiac output as well as the pulse pressure, and there can be increased risk of pleural effusion, hypoventilation and carbon dioxide retention. There will be decrease in the appetite, thereby the patient looks very thin and lean. Since there is a decrease in the appetite, the patient, even though he is hungry, he will not be able to eat the food. There will be lethargy, generalized slowing of mental processes, the mental thinking will be decreased, there will be stiffness, decrease in the deep tendon reflexes, as well as the thyrotoxicosis. Even the hypothyroidism can cause infertility, decreased libido, impotence, oligospermia, both in males and females, and also they are responsible for weight gain. So there is an increased appetite, but the metabolism is more in case of thyrotoxicosis. And in case of hypothyroidism, although there is a reduced appetite, the patient may gain weight because there is a reduction in the metabolism, and there will be drooping of the eyelids in case of hypothyroidism.